Hello, hello, hello. Happy Tuesday, March 8th, 2022. Happy Tuesday, ATHLers. My name is Abby Tyler. I am a family nurse practitioner and I am the host of Abby Tyler's Healthy Living. How are you guys doing today? For those of you who will be joining me during this broadcast, I say thank you. For those who will be watching later, I say thank you. So the topic today is Graves' disease, and also I put in parentheses hyperthyroidism. I'm going to be pretty transparent with you guys. It's a very detailed and complex topic too. So, and I saw it's going to be a little longer. I'm talking about hyperthyroidism, that's high thyroid, and this low thyroid. So they're both equally as important, but I decided to talk about Graves' disease today. So I'll be doing part one today, and then I'll be talking about the low thyroid on Friday. So today is about Graves' disease. As always, my disclaimer, whatever I say, I'm going to be talking about from the endocrinology. That's the part, that system, the doctors, the specialty that studies thyroids and your hormones and all. And also family practice guidelines, cardiology, and all that. So, whatever it is that I say here today, I don't make any changes to your regimen without first consulting with your own provider. Okay, so I am going to go in here. As always, I have to make sure that I am live on my other channel. So, and sometimes it takes a little while for it to come through on my phone. So I'm going to do this here and I'll be right with you guys. Okay. So let me just share that real quick. I will go back here and go there. In a few minutes, I'll be ready to go. Just spare me a few minutes. So making sure it's there. Post it. And one more. And I go here. Okay. Okay, so let me find that out. And okay. Okay. Alrighty. It was I'm back. So it was a really crazy busy day today. So and I had a couple of new patients, a handful of new patients, so that took up most of my time. And for me, and I had all my information all set to go, but I was very busy, and I wanted not to come on today because I was like, okay, I'm very tired. But I did decide to do this, and this is the thing about healthcare. Okay, I'm going to be honest. Is it's one of those things where people don't think about until something goes wrong. So talking about healthcare every week, trying to make a video and all that every week is very it's time consuming for one thing, and it's a very thankless job because, like again, I said people don't usually whether you're in America or wherever it is you in this world, people don't think about healthcare until something goes wrong, and especially when it comes to like a major pandemic, that's when everybody is involved. But even on your regular time, your regular thing, you don't think about healthcare until something goes wrong. So when you're talking about diseases where most people are not aware of, and it's not something that too many people talk about, it's kind of hard. So but I did decide to go talk about Graves' disease today because most people know who Wendy Williams is. She's the person that I put on the flyer. She's a talk show host that had her talk show and everything, and then and she had to stop her show because she got sick over a period of time. Let me just go in here for a second, and I got my banner. I'm just gonna go in here. So, and everybody, let me just put a picture of her for those of you who don't know reference point there. This is Wendy Williams. Sorry, I'm right there. Everybody knows she had a talk show for many years and she was very controversial. And so people were saying, oh, yeah, she deserved what she got because she was always saying something bad about people. And that's why she got it. I'm the kind of person, I'm not one of those people who believe that people get sick because God's punishing them or the Satan's punishing them for what they did wrong. She was doing her job and she just happened to have Graves' disease, which affects a lot of people in this world. So and I decided to talk about that because most people don't know about it. When you're reading about the comments and all, most people don't know what it is. I also wanted to talk about the main reason, also another reason I decided to talk about this is I had when I would live back home as a little girl. I'm just going to show another picture of a black person that has that. Okay, so this is a picture of one person who has Graves' disease. You can see the eyes there. This is we had a picture of a lady. We had a lady that was our friend. Where when I went to visit my cousins, they live another place where I used to live. So every time we went there, I'm just going to take a pic. Every time we went there, there was this lady, her name was Marianne, and she had what we, at the time, we just thought that she had witchcraft. So this poor lady, she had no friends. I think the only person that she had friends with was her mother, and she did have a daughter. Nobody was friends with her. We thought she was witchcraft. She never used to, when she come around to buy something where we're living, everybody be so afraid. You're afraid to touch her because you thought that she had something that you would catch. I remember one time, even when we went to church and she was sitting behind us and somebody whispered to us and we turned around and we like jumped right out of the way. And then she had a little girl. You could tell that she was in the stages of going to be getting Graves' disease too. And we were like, oh, well, who was the person who would want to be with her? And it said she had a boyfriend and he got scared and jumped out the window one day. So, and you think about that. And I look back when I started learning, when I started going to nursing school, my associate in my bachelor's and my master's program. But then I thought about her. I said, "Oh my God, this poor lady went through all that her life, and she was just a disease that if she had the medication to manage it, and if we had the knowledge of what was going on, this lady could have lived like a regular life." In that regular meaning that she would have been getting the medication and she would have been able to, and if we knew about it, she wasn't going to live her life where she was going to be so depressed and just knowing that it's not something that anything that you brought on yourself, but people just thought we thought she had witchcraft. So that's how we treated her. And it's just sad when you really think about the kind of life that you lived, like nobody, your entire neighborhood know anything about it. So I decided let's talk about it. And even when the fact that when I see the comments from Americans on these different social media forums that they're saying, oh, this is that, and she's faking it, and Wendy's faking it, and this and that, and she's big, and she's really a man, and she's pretending to be a woman, and all. I just said, you know what, maybe I need to talk about this, all right? Because most people don't know. I didn't know before I went to nursing school, and if I didn't have anybody who had it, I wouldn't have known either. I'm going to try to make this not to make it too long because I also this is a part one. I'm talking about hyperthyroidism. So Graves' disease. So it's Graves' disease awareness. I'm trying not to do things when it's like the awareness month because like I said, certain diseases they tell you this is the month that we talk about this disease and that disease. That's when we talk about it more. But as you know, healthcare happens continuously. So I'm going to start. Like I said, once again, my disclaimer, don't start or stop anything without speaking to your provider. So what is Graves' disease? Okay, like I told you guys, the thyroid, mainly it's the thyroid gland, okay? And doctors who take care of people with the thyroid and also take care of people with diabetes, they're called endocrinologists. So you'll be your endocrinologist and your primary care provider that's going to be taking care of your illness, and also anybody else who, depending on how the disease progresses. So you say, what is the thyroid? Your thyroid is right here. It's a little butterfly shaped thing right underneath here. I'm just going to show this picture. Okay, see, it's your thyroid gland over there. This is your neck bone right there when you feel their clavicle, and your thyroid's like right below there, right in that area. And you see that right over here. That's your thyroid gland. Like I said before, I think I mentioned it before. The thyroid gland is the one. It's like the motherboard of the body. It controls your hormones. It controls the people who have some menstrual problems. It controls your female hormones. This start coming into play when the girl becomes start going to puberty. It also controls your growth hormones. It controls just about everything in your body. And is there anything wrong with it? It affects almost everything that goes on in the body. And then depending on what's going on and all that, that's how it manifests itself. Now it's an autoimmune disease, like I said before. Autoimmune meaning that something goes wrong and the body starts to attack itself. That's why people have like lupus and other diseases that it just attacks itself. They don't know the real mechanism what's causing that. There's many theories out there, but it attacks itself. So I'm just going to give you like the scientific part, and I'll give you the clear patient stuff. So Graves' disease was actually discovered in the 1830s by Robert Graves. It's an autoimmune disease that is characterized by hyperthyroidism. So what happens is, make it simple. because I have my paper over here. Like I said, I try to prepare everything before I come on. So it's mainly like your body secretes more thyroid stimulating hormone, uh, more than the body can handle. So when that happens, it brings the you bring everything down, and the body cannot tolerate. The body cannot function when the hormones, because everything in your body has to stay this way. Like when I tell my patient when they come to do their routine testing and all, I said there are certain tests that the levels have to stay within range. Like certain things would be like, okay, you have to be, your blood pressure has to be this. Yeah, this one has to be this. But for your thyroid, you have to be within a certain range. If it gets too high, if the numbers are too high, then that means you go into hypothyroidism. It's a little different because the numbers, they're kind of opposite, and it's very difficult to explain that to people who are not in the field. So usually your thyroid stimulating hormone is supposed to be between 0.5 and to 5. So anytime if it goes lower than that, that means your body is secreting too much and it bringing everything down. So that's the reason you have to be on medications. Okay, most times you won't even know, you won't have any symptoms until it really starts manifesting itself. And then when you go into your doctor's office, that's why again it's important to follow up with your PCP every year, so you get your routine blood work done, and they also do your TSH, which is the test that we look for anything wrong with your thyroid. When that number comes back differently, you're a little odd, too low or too high, that when we do the whole thyroid studies, because I do the T4 and T3. Again, I'm trying not to make this as scientific, so keep people interested. So like I said, it should be between 0.5 and to 5. So the other end of this is the hypothyroidism. I'm doing hyper, meaning higher, thyroidism today. So there's so many issues. There are a couple of other different causes of hyperthyroidism. Okay, and Graves' disease is the most common. So most people, that's why when you see anybody with Wendy Williams or those kind of characteristics, chances are more than likely they have like Graves' disease. Okay, so we will go on here. Let me just move this away. I already told you. 1 in 200 statistics. 1 in 200 people have thyroid Graves' disease. The other causes of hyperthyroidism, Graves' disease is the goiter. You have that big growth that you see people come with and all underneath the neck, and if it's not controlled, it covers the entire neck. It can cause swallowing difficulty, breathing difficulty, and all that. Okay, it's more common in younger women and it's more common in women as well. And the other reason also thyroid cancer, and I told you the goiter. Okay, so we're not going to do the other one today. We're doing Graves' disease today. Okay, so the symptoms of Graves' disease. This is not comprehensive. It's pretty long, so I'm just going to hit the major ones already. Anxiety and irritability. Not like when you just, I don't feel myself, not every once in a while. But if it's something that's been going on for a long period of time and you've been noticing that, you want to bring that to your doctor's attention. Again, like I told you guys before, there's some diseases that they have other diseases that manifest the same way. So we have to rule out other things that would be causing your symptoms. All right. Fine tremors of your hands or fingers. If you like this, if you notice that every once in a while you feel yourself going like this, you want to, bring that too. Heat sensitivity and increasing perspiration. You mostly, you cannot and stand being hot, and you just feel like every time you feel over sweaty. Weight loss, even though you're eating healthy, even normal eating habits, you can find yourself losing weight. The goiter, like I told you about, I have a double chin. It's not goiter because I'm gaining some weight, but no, it's like literally underneath here because your thyroid gland is over here. You're changing menstrual cycle. Usually when the child starts getting the period, it won't be regular first, but then over a period of time, you start noticing that your period is either you're getting it every month, you're not getting it, or you're getting it 2 or 3 times, and it may be heavy, it may be too low, all of that. Because the body, when you get to your pubescent age and all that, the body sends the signal to the thyroid gland to say, okay, your endocrine system saying, oh, it's time to start secreting because this person has to go to puberty. So that's when they start secreting it. So if there's any problem with your menstrual period, your GYN, your gynecologist will also draw your lab work to make sure your thyroid, you're not having any issues there with your menstrual cycle. Frequent bowel movements. You shouldn't be having too much diarrhea. Sometimes it's not even diarrhea. It's just like frequent. You go in frequently. So you want to get that checked too. Or the other symptom there, most people don't get this, like in this called, that's the eye disease. Okay, let me show that again. Okay, you see that most times that's the eyes. That's the way the eyes look, and you look at that and you're thinking, oh my goodness, what's going on with that person? Is that person something wrong? Why did it look? It had that look of surprise. Graves ophthalmopathy. And most people just happen. Most people, like 30% of people who have Graves' disease, that's just a buildup of carbohydrates behind the tissue, and that caused that to happen. That can happen even if you don't have Graves' disease. By the way, if you see that in the Caucasian person, that's the way the eye look. And just imagine, in America, people say that and be like, "Well, okay, look at that." And then imagine in when we were in Liberia, where most people didn't know, the people that I knew didn't know anything about thyroid disease. So that's the kind of thing that's one of the symptoms you see there. Guy's got the bulging eyes. Gritty sensation because your eyes are like always open wide like that. So you've had that gritty sense in your eyes, pressure and pain in the eyes, puffy, which your eyelids are like so stretched open to where your eyelids are pulled all the way back. Light sensitivity, double vision. Some people have some vision loss. You always fatigue because your body is like so irritated, so irritable, and you have to go through you burning calories so fast. And also it can affect your skin too. You can have like rough skin over there, so you can look at that and be like, okay, what's going on there? So the causes of that and risk factors, it mainly goes back again to family history. If your family member had Graves' disease, that's a new risk that you may develop it. It's hereditary, meaning it runs in the genes. Sex, like I said, women are more likely to develop Graves' disease than men. Age group, it usually affects people, develops under age 40. Okay. Other autoimmune diseases too that can also precipitate that, like your type 1 diabetes. If you type 1 diabetes is the one you get when you're very young, you're born with it, or you get it when you're very young. Type 2 diabetes develops later on. So you can go back and watch my diabetes show for that. Rheumatoid arthritis, and so all those other autoimmune diseases can also increase the risk of that. Emotional physical stress, which is something that we can't really, it, and you doesn't mean because you're under so much stress you develop it, but your body does respond to being under continuous stress. If you're worried about all the time, but it affects the heart, it affects your breathing, it affects everything, your ability to fight any kind of infection, because your body is under so much stress that it, to develop that, like I say, you have your body's supposed to be preparing to fight for war, but it's under so much stress and so much pressure for something else. If you do get infected, if for something, you may be much sicker than you're supposed to be because your body's like so defeated from being under stress for so long. Pregnancy can also induce that, and smoking. So if you have Graves' disease, they tell you not to smoke. Alrighty, so I will see that there. Okay, go. I don't see any questions yet. Alrighty, so some of the complications of Graves' disease. If you have Graves' disease, if you're pregnant, it includes a miscarriage. You could also have like very early birth, preterm delivery. The fetus can come out with some thyroid issues as well. Poor fetal growth because of the hormones, so the baby may not develop effectively. You can also have heart failure because your heart's working so much harder when you have this disease. Heart disorders, if left untreated, your disease can go on to having heart dysrhythmias, or your heart different rhythm. Your heart's supposed to beat the rhythm. When you look on the screen, any kind of, you see, always see this nice little thing going on. It could go like that. You could have other issues that could cause severe problems for you. Changes in the structure of your muscles, your heart muscles, and your body, because I told you the heart failure video we did before, so your body cannot pump enough blood. So it's a pretty serious disease to manage, and it's pretty serious disease. If you don't get it managed, you can run into some complications. So that's why when you do get diagnosed with it, it's very important to follow everything your doctor is telling you to do. And brittle bones, because the body is putting out so much hormones and all that too, that can lead to your bones being very brittle. So in case as you get older, you have a higher chance of breaking your bones. So even when you're younger, because osteoporosis usually occurs after when women, after they go to their menstrual cycle, menopause, and the body is not producing new bones anymore. But this can happen when you're even younger, and that can cause a problem. Okay, and then the thyroid storm is, if it's not treated correctly, then you have to run into the point where you have complications, severe heart disease, severe heart problems, where you have to be rushed to the hospital. So if you live in a country where you don't have all those things going on, and emergency response system, and the hospital is equipped, and doctors and specialists and nurses and other people that are trained to do all this, if you don't have that, that can cause a lot of problem. Okay, so you say, how is it diagnosed? I'll take a little break there. Okay, so to diagnosis, usually, like I said, at this time, you won't know anything is going on until you go to your primary care doctor, or you happen to be in the hospital for a heart problem. Other issues when you go see when you're pregnant, and you see your OBGYN, and they do your routine testing. If you're in a hospital for a heart problem, they're going to do your blood test to make sure to see what your thyroid level is, to make sure that the heart problem that you're having is not being caused from your thyroid. And like I said, your thyroid gland is the motherboard of everything. It takes care of everything. Okay, so they're going to check on that in addition to everything else. So when you come to see me, we're doing your blood work and we're doing everything else. And then when we get the results back, we'll look at that and say, okay, if we'll do your history also and making sure, and then we see the results back. When we get the results, we do more testing if we have to before we start you on any medication. Okay, some people be like, well, I don't want to start any medication yet. Usually we'll check it again in about 4 to 6 weeks. But if it's like really pronounced, then you know that, of course. And again, the number will be less than zero 0.5. So that's when we really start worrying about that. That's when we have to start your medication, because again, we tell you it can have devastating consequences, especially with your heart, if you don't get it handled and treated effectively. Okay, so we'll do your blood work, you do your TSH, we're going to do your whole um checking for anemia, checking for infection. We're doing everything included in that. So it's not just because when we're taking care of one disease, we have to take care of everything else that you're coming along with. Asking you about your family history, asking about if you ever had any issues with your thyroid before. Are you having any problems swallowing? Are you noticing you've been losing weight even though you're eating okay? Are you having frequent bowel movements? Everything I listed before the symptoms. So we'll be asking you about that. Alrighty. And then also we can also do it if the ultra is that TSH come back very low, the thyroid stimulating hormone. We can also do ultrasound, just ultrasound your thyroid gland just to make sure everything's okay. I think one time he worked this on HGTV, and I think another star recently, they're watching TV and somebody noticed that they're right there while it says the thyroid right there, right in the area. It looked like it was a little swayed to the side, looked like a little bunched up, and a little more enlarged than normal. So it couple of nurses are watching and they call the show and say you might want to get that checked because you look like you have something with your thyroid, and sure enough you have thyroid cancer. So, and you want to make sure you check that very quickly as possible and go to the oncologist, and that's when other doctors will be into that. But Graves' disease doesn't mean that it's going to go to thyroid. It's just totally different, but that can also cause enlarged thyroid too. All right, so we'll do a thyroid ultrasound, and then if we see anything there, then that's when we're going to send you to see the endocrinologist, and the endocrinologist and the family doctor would be doing everything working together. Okay, so there are many treatments that they can do. There radioactive treatment, iodine treatment. They could do that. That's a little more detailed than I want to get into. But there are medications that we can put you on for anti-thyroid medication, and the most it's different when you're taking you're pregnant, and then if you're not pregnant. So your doctor, your OBGYN will find that that's what we have to do, pregnancy test. If you're female, especially of childbearing age, we have to do that, make sure you're not pregnant so we know which one to put you on. All right, so the first choice would be Tapazole. That's the one they do on. Doesn't mean you talk to your doctor and that's the one, the guidelines that we started with. And it's also, as always, there's also side effect with every medication. So your doctor will explain to you and tell you the risks and benefits to go with. For people who have like serious heart issues and irritability, anxiety, we can put you on some medications. They're called beta blockers. That's supposed to kind of calm you down. But it's also like a blood pressure medication too, and it also regulates your heart rate. So if it controls everything, kind of calms you down and takes away all your anxiety and all. And sometimes you may need to be on anxiety medication. So if your blood pressure usually runs low, your doctor may prefer to prescribe something else. Okay. And if as last result, if nothing is working and you're still having issues and to where you're having severe thyroid problem, and like I say, go into complications, they may talk to you and they will decide, we've done all this and nothing seems to be working, or it's not working effectively, and you're not living your life the way you're supposed to be living, like a productive life. It's affecting the way you live, it's affecting your job and everything you do at home with your family. They may say, okay, this is what we have to do, something surgical, especially if it's getting to the point where it's causing you difficulty breathing and eating and swallowing and all. That's when that would be some of the reasons why they would decide to do surgical repair on that. Okay, so for the eyes, for people who have the eyes, they put them on some steroids, also to make sure that they decrease the blood flow to the area. There's other medications too. Like I said, I don't like to talk medication because you have to say brand name and a generic name, and I'm not endorsing any brand name. Okay. And I'm not working for any pharmaceutical company. I know people say that when people who work in healthcare. For the eyes, when you have problems with the eyes, when you're at home, they tell you what you can do at home. You want to apply some cool compress to your eyes every once in a while, some eye drops. Make sure you wear some sunglasses. That's why you see some people they're wearing sunglasses during the day, and you're like, or like evening, and you're thinking, why they're doing that? So unless you know what's going on, using lubricating eye drops, so like ointment, so that it stays in there and it keeps the eyes really moist. When you're sleeping at night, you want to elevate your head so it keep the pressure from your head and all that is going to put more pressure in the eyes. If you smoke, try to quit smoking, cut back, quit smoking. There's so many different helping there to do to quit smoking nowadays. Like I said in the other show, you can use the patch, you can use the gum. There are other medications by mouth that you can take to help you quit smoking. You want to quit smoking because all of that would just aggravate your symptoms more. Okay. When you're home, you want to eat well, exercise, also do a lot of relaxation thing because like I told you before, the stress from if you under severe stress and all that can also exacerbate your thyroid stuff. So you'll be taking the medication. What you first do the medication when you first get diagnosed. First, we give it to you. We give you the medication. We're testing you again in 4 to 6 weeks. Some people like 6 to 8 weeks, and then the medication will be regulated based on what your levels are. Also, like I said, we'll send you to endocrinologists so they can see you and work along with you. Most times we'll be doing it in the office unless if we have to send you to endocrinologist, depending on your other presenting symptoms and how complicated your case is, we'll be working along with the endocrinologist. In some places, there are no endocrinologists and the family doctor takes care of everything. Okay. And like I said, easing your stress. So if you think you have this, and if you said when to see a doctor, you absolutely want to see a doctor. If you find your heart racing, you're short of breath, you're more anxious than normal, you find yourself panicking, you do want to make sure you go to the emergency room because it could be heart issues. It could be you're having a heart attack or something else going on. So you want to make sure you take that. Like again, like I said before, many diseases have the same symptoms. So you want to make sure that you're following up with you want to make sure you want to get the emergency part out of the way first, and then we take care of everything else. Okay. So you want to make sure if you see your heart racing, you want to make sure any kind of rapid regular heartbeat and vision loss. If you find yourself getting blurry vision, or you just your eyes go out like that, you want to make sure you call 911 and get to the hospital as fast as possible, because we want to make sure you're not having a heart attack, and we want to make sure you're not having a stroke. So you get those things out of the way, then the family doctor can continue after your discharge, and also the endocrinologist. Okay, so when you're going to go see the doctor, all right, and I'm going to be talking about this too next week with the hypothyroidism. So write down any symptoms you're experiencing, including anything that may seem unrelated. You'll be like, don't think, oh yeah, they don't really need to know that. Just write that down. Write down the personal information, including your family medical history. Remember, I told you your risk factors is one of, if your family member had it. Any major stresses in your life. That you just recently moved? Did you recently have a baby or anything major, some death in the family? You want to make sure you write that down. Make sure you write the list of all your medications. Make sure you write the time you're taking your medication, the dosage. Like I said, aspirin, 81 milligrams. I take that by mouth. I take that daily. You can't just say I take aspirin, because is it 81 milligrams or is it 325? So you want to make sure, even before that, when you're doing your medications, you want to make sure you have that written down somewhere. For older people, I would say bring all your medication bottles with you, because that way when we're there, we're looking at the different medications. And if you have other doctors that prescribing medications, also bring everything with you, because some people can't remember everything. And sometimes you may forget the list, or you don't have it in your phone. Just bring the whole bottle with you. I tell them this time, I tell my patients, whenever you come to the office, please bring all your medications with you. So at least that way we have to do, like I said, the medication reconciliation, to make sure every time you come to the doctor or to any specialist that you make sure that you're taking the right medication the right way, the right time, every time. Because if your blood pressure is really high, and if I prescribe your medication and you haven't been taking it, and I'm keep increasing it, to find out you haven't been taking your medicine, that can be detrimental to your health as well. And then also by law, we're supposed to do the reconciliation at all times. All right. Make a note of everything and write down questions to ask your doctor, because when you go in there, again, you're in there with a doctor and you're there for 15 minutes. Okay. 15 minutes from start to finish, you're not going to remember everything you have to ask. So make sure you have your questions written down and ask the questions, and we can answer it. And sometimes we go through it and we'll tell you actually if we have any questions. Okay, so make sure, so, I have some questions written down. Can I just ask you these questions and then we can go on from there? And sure, any good provider would say, sure, let's go over it. If it's too long, and if sometimes we can put two questions together, or if we answer one question, we can answer one question that covers three of your questions. Okay. So the doctor will be asking you what it most likely causes these symptoms. Do you want to ask what kind of tests will I need? What do I have to prepare for these tests? Like I said, your ultrasound, whether the TSH and the thyroid studies, will be checking for that. Is this condition temporary or long lasting? You want to ask that. For most people, it's chronic. It's going to continue forever. The kind of treatments are available. And just so many new treatments now to the other things that can do it, just a few that I mentioned before. So you want to make sure you ask that. And then also get your family and find out where you can get more information on Graves' disease. They have the Graves' disease association that you can check on that. There's support groups on Facebook and other places as well. Okay. So of course, when you go to the doctors, we're going to be asking you this question. Like I told you before, the HPI, history of presence and illness. So we're going to be asking you these questions. All right. Well, actually, when did you first notice your symptoms? Do you have these symptoms all the time, or do they come and go? Have you recently started new medication? Because some medications can also cause your thyroid issues too. Some hard medications can cause that. Have you started new medication? Have you experienced any rapid or intended weight loss? I mean, you shouldn't, most people, when you're doing weight loss program, it's like two pounds per week. But if you're not trying to lose weight and you're eating okay, you shouldn't be losing weight. Okay. Maybe if you're a female of childbearing years, meaning you're still seeing your period anywhere from 9 to 55. When you get closer to like 50, 51, your period starts to slow down. So that's different. That's when we start looking at a different kind of hormones that control menopause. Okay. So that's when we know that you're in menopause, because we can do the testing for that. But if you're still younger, we're going to be seeing, is your period different? There's also polycystic ovarian syndrome, where your periods is completely different. And also for people, that puts you in a high risk of also getting type 2 diabetes. A lot of people have that. It's called PCOS. And people have problems getting pregnant and everything else that comes along with it. So once again, the thyroid gland is very important, and it controls just about everything in your body. Okay, so we'll be talking about that. Have you had any problems with sexual dysfunction? Some people have low sex drive because of that, and that can be men and women. And you could be saying, "Oh my God, you don't find me attractive anymore. You're not doing this." It's not something they're doing deliberately. It's the hormones and everything is testosterone. Thyroid controls that too. In men, they may not be, maybe out of range. You also do your PSA to check for that, and that may be too low, and they may not want to do. They may not want to work on that. Also, when you check your prostate to make sure you don't have prostate cancer, all of that, we'll do the test first. So you see how important the thyroid gland is. Okay, so it controls everything. All right. Are you having trouble sleeping? We'll ask you when you go to sleep. Are you having trouble falling asleep? Are you having problems staying asleep? So all those things will be asked, and we'll go on from there and talk to you about it, and making sure that keep you safe and sound. So it's important. And as you can see, and you have to make sure, and as over time, if you're doing anything else, if you're smoking, if you're doing any kind of illegal drugs, anything else, because you have to stay, it has to be tightly controlled in order for you to maintain a decent life. But some people have the complications from it, like Wendy Williams and other people, who I only call her because she's the most famous person that I know with it. So, and it can affect your life. I mean, right now she doesn't have her talk show because she cannot liver her levels and everything, her symptoms have become so bad over the years that she can no longer function, work in her field. For her, she has money and she can live, she's got good enough money that she can live for the rest of her life, and she doesn't have to work. But if that's like for somebody like me and you, who, you depending on your paycheck, you also need health insurance, you need this, you need that, you have family life and all, you have children, that can be very devastating. So it's very important that the symptoms that I listed before, you can go back and play the show again and see if it's something that if you haven't. There's also another thing called thyroid eye disease, that you can have that without having what I showed you before, and that can be even more complicated. That can also lead to vision loss. So there's thyroid disease where the exophthalmos, and then the thyroid eye disease. So it was so funny because as I was getting ready for this, it was like the commercial came on maybe like 5 or 10 times, and I'm thinking, Okay, that's kind of odd. But yeah, so your ophthalmologist will be seeing that if you have thyroid. Also, you have to see ophthalmologist, and they can go ahead and some of the surgical repair. Also, they can also try different medications. There are different experimental medications on the market right now, so they can work on that. Because that also, if you can't see, if you have any problems with your eyes, that's so important. That can just take away your whole independence. And if you have children, you have family, even if you don't have any of that, that still takes away your independence. So it's important that to make you aware of that. So that hyperthyroidism on Friday, I will do the one hypothyroidism, where it's HYPO. So more people have that one than this. But I just wanted to bring that to attention. And I just the fact that when I look back on when I lived in Liberia and this poor lady, I mean, the knowledge. And if she had a way where she could go to a hospital and get diagnosed and get treated, her life would have been so different. And imagine so how many other people who suffered with this simply because we didn't have the knowledge of it. And even over here, those people who have it and people are saying, oh, you're getting it because God said this and somebody's punishing you that and some no. So how would you explain to 20-year woman who living her life and doing everything right? Wow, how would you explain why they got that disease? How would you explain to somebody innocent person who teenage years and they're having problems with their period and they have to go through this, or somebody who's having problems having babies and find out that this is the reason why you're having issues? How would you tell them that? So it's not about, and I'm a Christian person, but I don't believe in you being punished because God said you were this, you were that. Because I always say, what about people who didn't do anything? You have people who are nuns, who are priests, who are, fathers and everything else who are doing this, and they've been living a good life. I mean, they're not holy, but at the same time, they're not doing anything to deserve it. So you want to make sure that you read more about it. Like I said, there are issues, there are websites out there, there's some support groups. You can speak to your doctor whenever you go to your doctor. You get your blood work done, your yearly blood work. You want to say, doc, what's my TSH? And if you have any of those symptoms that I'm talking about, make sure you bring it to their attention, because it could be thyroid issues, it could be Graves' disease, or it could be something else, something more serious that's going on with your heart that you want to make sure you get that checked. Okay, so Friday, like I said, I'm going to be coming back. I'm already 37 minutes into this, and it's a very complex issue. It's not one of those diseases where it's like just cut and dry. Okay, but most times when people see this, it's like the eyes. The eyes is almost the first one that shows it, because everything else you'd be thinking, well, most of the time I'm a little irritable, I'm a little anxious now. So you're not thinking too much about it. But when you start seeing the eyes, and that doesn't mean everybody's going to develop it, by the way. So don't think that, oh yeah, if I don't have this, I mean, if I don't have the eyes thing, that mean I don't see it. But that's the most noticeable one. Alrighty. So let me just see if there's any comments here. Okay. Jackie Jackson says, one of my favorite and my most supportive cousin. This is such a great topic. There are some people who are struggling with this and is somewhat refusing full medical recommendations. It is. I mean, like whatever disease, because you don't want to know what's going on. I mean, you want to know what's going on, but you're so afraid because it changes your life. With any kind of illness, any kind of chronic illness, it changes your life. And you try and, it's like you say, okay, okay, tell me, dog, what am I dealing with? Okay, so how's this going to affect my life? Like I read the different things that you have to ask your doctor. How's this going to affect my life? Is this going to affect me from working? What if I go travel somewhere? Can I live in somewhere else? Can I live, I mean, if you're always cold, if you're sensitive to the heat and all. So it's scared, and it just takes a little while. It takes a lot of encouragement, a lot of sensitivity to say, I understand that you're scared, but you need to get this checked, because it's not going to go away. It's not a disease that's going to go away. Your body is attacking itself. And so you have to make sure that you have the medication in between. So keep everything, normal in order for you to live your life. It is scary, but you can have a productive life if you get a check and it's managed effectively. Okay, so you have to see a PCP, and then when they send you to the specialist, you follow up. I have people who I'm like, okay, I'm waiting for your levels to come back. I told you, you have to get your blood work done in 6 weeks, and you haven't done it yet. If you continue taking this medication, you're taking the lower dose, or you're taking the dose that is not supposed to, that's matching your blood work, you're going to run into problems, and some people, like, they're busy with work and school and children and all, and then they just fear. That's why I say healthcare, talking about healthcare every time is like thankless job, because most people don't want to think about anything going wrong unless if they absolutely have to think about it. Okay. And then let me just go in there and so sorry. Sometimes it's okay, they're saying this is cultural or their beliefs that are preventing them from assessing all of the necessary treatments. How do you explain the importance of this diagnosis? I think what I would, like I said, I'll say it's not cultural. Like I said, I knew this from the time we were younger and it was scary. And some people say it's witchcraft. Or, if I pray to Jesus, I pray to God, or I pray to whoever my higher being is, it's gonna go away. This is something else that's going on. And we respect that. We always respect saying that this is what's going on, and you think that maybe cultural, you may be thinking of something else that's going on. Which I tell people, I say I totally respect your culture. I totally, and even with me, I mean, we also believe in witchcraft, and sometimes I joke about it myself. I'm like, oh my god, as soon as I started, I graduated from school, that's when this is happening. I bet you somebody's playing witch on me. So we talk about things like that. But it's gonna, you say, okay, we're gonna go do the ultrasound. All right. We'll do the ultrasound. This is your ultrasound result. We're reading it to you. This is what's on the paper, because sometimes we do the interview and everything, we do everything, but you need objective conclusions to say this is what we're dealing with. Because, and this is your blood test. This is what we're dealing with. You want to wait a little bit? Fine, we'll wait a little bit, but I need you to come back. Please promise me you're going to come back to the office so we can go over this. Because again, it affects your heart, it affects your eyes, it affects your hormones, it affects your ability to get pregnant, it affects your period, it affects so much of your life. It encompasses everything, and in every part of your life, it takes over. So you want to make sure, okay, yes, I understand you think this is cultural, but can you just take care of it while you pray into God? Can you take care of it while you're trying to drive away the witchcraft people? Can you do this? Because you have to do that in order to stay healthy. Okay, so just do this. I would just say, just do that, and then you can continue with everything else you're doing. Because, like I said before, we don't discourage anybody from praying. We don't discourage anybody from saying that only God can take care of this. But isn't that, I think, a Bible verse that says faith without works is, I don't know the rest of it. I know that's what faith without works is something. So, and I say the Pope, who's the holier person, when he gets sick, he goes to the doctor. They have doctors, they have other people taking care of him there. Priests, there's all those people, they believe in God, but they also believe in the fact that God bless the doctors and NPAs, the PAs, the social workers, everybody else, and physical therapists and lab people, because they always say we don't mention them. It bless them with that knowledge. So if in as much as you believe that you can get on the plane and trust that the pilot is going to take you from point A to point B, pray nothing else happens. You can also believe in the fact that this doctor or this PA or this NP is looking at your test results and giving you the best treatment possible and giving you the best advice possible. Now, nobody's going to force you to do it. If you decide that this is not what you want to do, we'll tell you, okay, you're fine to get a second opinion. I always tell my patients, I say, take your test results. Here you go, take your test results and everything, your ultrasound results, take you to another doctor. Okay, they can also look at a film directly from the hospital, from wherever you got it done, and then they can tell you, this is what we're looking at. And there are options to different treatments, options and all that too. So they can tell you that, but this is what we're looking at. This is what it's been. So after you get to that point, you sit down and think about it and say, this is what I'm dealing with. I have an illness. I have to deal with it. Unfortunately, nobody wants to be, but I have an illness. I have to deal with it. And I know that if I don't deal with it, it's going to deteriorate. Okay, I can still pray and I can still get all the treatment that I need to get. And you're in a country that has all the different advantages, all the different technologies and advanced technologies and everything else. And if somebody who in your culture wants to say, oh, look at her, she's got this, she goes, who cares? Who cares? You're getting the help that you need, right? If you had heart problem, would you sit at home? If you had knee problem or stomach problem, would you sit home? No. Get the help that you need. It's okay to be afraid. It's okay to be fearful. It's okay to believe in your culture, the beliefs and all that. But you want to make sure that you get the help that you need, because eventually it will deteriorate and it will cause you to lose your independence and your livelihood. Okay. So I hope I think I got all the questions there. And on Friday, I'm going to be talking about hypothyroidism. That's the one that affects a lot of people. So for those of you who will be watching later, I say thank you. And for those of you who will be watching, who are watching now, I say thank you also. Thank you for my loyal supporters. And thank you also always, Jackie. Thank you. You know, so until I see you guys on Friday, I'm gonna come on at 7 o'clock. So at least that way. Friday is getting a little busy now because the weather's getting nicer and we have so many things going on Friday. So there will be times where I won't come on Friday, but I will come on Friday to do the final part of this on. And then if I change my mind, I probably do Thursday, but I probably do Friday just to get it over with. And that's the one that affects a lot more people than the Graves' disease. But I just wanted to make sure that people know that Wendy Williams is not somebody who's doing stuff that is causing her to, and it also affects the growth hormones too, by the way. That's why some people are like big, when you say big bone or higher, and all depends on if the test was done. So it affects the way how you, for a woman, she can become, much bigger, her stature is much bigger. And people say, oh, she's really a man. And no. It affects your growth hormone, affects your ability to your menstrual cycle, your pregnancy, your heart, your stomach, everything. It affects just about everything. The endocrine system, the thyroid, runs the thyroid and your diabetes. So if you see an endocrinologist, he or she takes care of your diabetes and your thyroid, which is the hormone and all. Okay. So I don't see any more questions there, so I'll be back on Friday. This topic is very detailed, it's very complex, and I was going to explain the lab. Oh, trust me, that's even confusing for even us. So, but until we meet again, I think I've been on there for about 45 minutes. Okay, so thank you all for watching, and I will see you all on Friday. Thanks again for your love and support. And I will see you on Friday. I know some people were concerned about, if I'm a doctor, if I'm a nurse practitioner. Most people don't know what family nurse practitioners do or nurse practitioners do. We do everything the doctors do. I'm not one of those people who say, oh, yeah, I'm just as, I know I don't have the same amount of years of education as the doctor, but my liability carries the same thing. I have my license. I'm not doing nursing. This is not nursing. This is like you're working. I'm not pretending to be a doctor. The what I went to school for and my job description. I'm doing taking see my patients. I'm diagnosing. I'm following up. I'm doing testing. I'm working with other doctors, other consulting doctors, specialists, because I'm a family nurse practitioner. So we do everything, unless if it's outside of our scope of practice. Okay, in about 27 states, nurse practitioners work independently, and I don't have a supervising doctor. I have a collaborating doctor because I work in Pennsylvania. In my part of Pennsylvania, I can work independently, but my collaborating doctor, her name's on my other thing, but when she's not looking over me, she's doing her own thing. I have my own patients. She has her own patients. Okay, so and thank you all for your support over the years. I've been doing this now for about, I think, 2014. So, and I thank you all. I don't want to keep talking until I bore you, but I just wanted to get that part out, that I appreciate the audience. I started with mostly just Liberian people because I wanted to give information, health information, in a culturally relevant manner. Because I always said, if you're Liberian and certain things you don't understand, and they tell you don't do this, and that's not what you do, or you don't understand certain things the way we present them. So I try to do that, but I'm happy that you all have followed me all through, and I will see you guys on Friday at 7 o'clock for part 2. Okay. And if you have any questions or comments, please put it below for my YouTube people. Thank you as well. I love you all. Thanks for your support. Thanks again, Jackie. Okay, you take care, and I'll talk to you guys later. Okay. Bye-bye. God bless.